of Providence Care. As a sister of Providence of St. Vincent de Paul, I am very, very proud of all that has been done, all that is being done, and all that I know will continue to be done in carrying on the mission. For a few years, my role was to be a liaison between the leadership team of the Sisters of Providence of St. Vincent de Paul and the Catholic health organizations that the sisters sponsored here in the East as well as in the West. And in doing that, I was aware of the great leadership and foresight of our sisters. As it became evident that we could not continue the works that had been begun, the sisters systematically transferred their health organizations to corporations that would continue that ministry. And they did so by promoting the mission in every facility and encouraging board members and staff as they went forward. So in 2006, the Sisters of Providence transferred the sponsorship of Providence Care to the Catholic Health Corporation of Ontario, a corporation that was committed to carrying on the mission. And you know, as healthcare people are wont to do, we very often shorten the title, and you'll hear us say CHCO. Now you know what that means when that comes up. Getting back to 2006, in order to ensure a seamless transfer of sponsorship, I was appointed to the board of directors of the Catholic Health Corporation of Ontario. And now I am the CHCO designate on the board of directors of Providence Care. Now, in modern day language, that process might be referred to as recycling. And there isn't a Sister of Providence in this chapel today who hasn't known about that process for a very long, long time. They've been appointed and reappointed and so on to many ministries, many wonderful ministries. I would have to say that for me, it is an awesome privilege to see committed staff and volunteers not only caring for the sick and the elderly, but they are growing and expanding the mission. This is a great sign of hope for me. Now today, my real role here, I just would bring you up to date a little bit on the history. Because when I was going around Providence Manor just before the service, many people met me and said, well, what are you doing now? So just to let you know, I'm shuffling through, and that's what I'm doing. But I do have a special role today. And I am here on behalf of Mrs. Lil Bergamo, who is the chair of the Board of Directors of Catholic Health Corporation of Ontario. And on behalf of all the members of the Board of Directors, I am wanting and sincerely missioned by the board to extend sincere congratulations and gratitude on the occasion of this remarkable 150th anniversary. Your sponsor, CHCO, is very proud of Providence Care. You are a star in our family of 18 Catholic health organizations. And you know, we are especially happy with the approval for the new hospital. That gave us great encouragement, as well as I know to all of us. And believe me, we will follow with interest every step of that building project. And also our chair and board of directors wanted me to assure our founding sisters, the board and the staff of Providence Care, of the continuing support and prayers of CHCO. We will journey on with you, always walking in hope and trusting in providence.
Good afternoon. It's my great pleasure to be here today, both personally and on behalf of the Board of Directors of Providence Care, to participate in this very special service. Our Board of Directors includes 22 members, each of us from different backgrounds. We've got different work experiences, we're from different parts of southeastern Ontario, and we're from different age and cultural groups. We are a reflection of the community in our region. At the beginning of each board meeting, after we've shared a prepared reflection together, and generally it's around our mission, but I ask other directors around the table if they have any stories to share about Providence Care that they've either experienced or heard through the month. Often, we hear about individuals or families who are grateful to Providence Care for the support that was provided while a relative was sick or dying. We also hear stories of how, because of Providence Care, an individual can continue to live at home. And of course, there are always examples of the excellent care here at Providence Manor. I was at a social event on Saturday night and was privileged to hear another tribute to the wonderful care that someone received here. It happens every time someone finds out that I'm associated with Providence Care. We share those stories with each other before we get into the business part of our meeting, because as a board of directors, we are an important link between the people of southeastern Ontario and Providence Care. These stories connect us in a very real way to our mission to enhance quality of life. One of our main roles is to share with management and staff at Providence Care where the organization is meeting the needs of the community and where there may be new opportunities in the future. As you know, and as you're hearing today, Providence Care's history is rooted in a tradition of identifying and serving people who are in need, those who may fall between the cracks in many situations. I believe the need for this tradition will continue and probably even accelerate in the years ahead. We're all aware of the challenges in healthcare today. Our system is changing, and it will need to change, to continue to change, to meet new demands. There are more seniors now, and those numbers are expected to increase. People want to be able to access care near where they live, and in ways that allow maximum independence and dignity. Funding for healthcare and community services is complicated, and the dollars often never seem to come and increase as quickly as the need. We need models of care that meet the needs of today. And so in facing these challenges, I think it's really fitting that we're reflecting back on Providence Care's history today. Over the years since 1861, There are countless examples of individuals who have gone above and beyond to care for and serve people whose needs were not being met by other agencies. We have the sisters, for 150 years in Kingston, have cared for orphans, the elderly, the sick, the poor, and many others. We're also remembering people who advocated for and built the first psychiatric facility in Kingston to make sure that people living with mental illness could move out of the prison basements and stables. There are pictures through the years of people, patients, residents, clients, smiling side by side with their caregivers and family members. Without knowing their specific stories, I can see that these images share a similar theme of compassionate, respectful care. In many cases, these same stories are about people pioneering new approaches to care. Our community has benefited from Providence Care's innovation as well as the high quality of service. A current example is the work Providence Care is doing to see our new hospital built on King Street West. Already, we're talking about how it will be a building that is accessible, that maximizes the beautiful natural surroundings, and makes the experience of patients and families as positive as possible. It will be one of the first hospitals in Canada to have long-term mental health care programs in the same building as other clinical programs. This will help with the stigma often associated with mental health care. It will also be easier for individuals receiving different types of treatment to access what they need all in one place. It's this spirit of commitment and determination that will be important as Providence Care moves forward and considers its next 150 years. As I said, there are many challenges to the healthcare system ahead. There are many people who are in need who may not currently be well served by existing programs. Today, Providence Care is involved in or leading new initiatives in supportive housing, care for the elderly, partnerships with the Canadian Forces, training new healthcare professionals, and researching new therapies, medications, and practices. We have active engagement with Queen's University and St. Lawrence College, and we have a number of programs in our communities providing care outside institutional settings. It's in these ways that we will continue Providence Care's tradition into our future together. As someone who lives in the community, I want to say thank you to the staff and volunteers at Providence Care. Thank you for the century and a half of service we've been celebrating this year. Thank you for continuing to provide the best care, programs, and services we could ask for. Thank you for your pledge to continue to meet our community's need in the future.
Good afternoon. It's an honor and a privilege to be with you here today to celebrate the 150th anniversary of Providence Care. And I would like to begin today by thanking everyone who has participated in the service today, and to thank each one of you for being here to celebrate with us. A special thank you to Neil Elford, who has organized this celebration and did so with great passion, and to his staff, and Jen Goodwin and her staff in the communications department, and Sheila Nowlin and the staff here at Providence Manor in supporting Neil in organizing this celebration. Thank you to the Sisters of Providence for being with us today and for allowing us